Good afternoon, everyone. Thank you so much for being with us once again in our Montefiornaya community chats. This is Sandra Arevalo, and I'm the Director for Community Health and Wellness. Today, Thursday, what is the date today? October 28th, we're going to be talking about autism. And it's so much to talk about that we're just gonna leave it like that. Autism, it's broad enough. And we have obviously people here as every week that are experts in the field, and they have a lot, not just to teach us about autism, but also lots of resources to offer to individuals and families of individuals living with autism. So without further ado, I'm going to start with introductions. So first of all, Randy Rios Castro, thank you so much for being here. She is the CEO at Jawonio. So if you want to just say hi and tell us a little bit about you.
So my name is Randy Rios Castro. I'm the Chief Executive Officer for Jawonio. I've been here for 3 years, but I have over 25 years experience in the field of developmental disabilities. And I've been the CEO for Jawonio for just over the past year.
Thank you very much. Then we have Carla, and Carla is the social worker at Jawonio. So Carla, do you want to tell us a little bit about you?
Yes, my name is Carla Brakovich, and I've been with Jawonio for about 3 years now. I have quite a bit of experience with mental illness, mental health, and quite a bit of experience with developmental disabilities as well.
And thank you very much. And Kristen, you are the Supervisor of Behavior Specialist. So tell us about you, please.
Hi, my name is Kristen Kiggins. I'm the Supervisor of Behavior Specialist here at Jawonio for our residential and day hab programs. I also am an adjunct professor at Long Island University's mental health counseling program, and I work as a private practice counselor in the community in Rockland County. And I've been with Jawonio for about 3 years at this point, but I've worked in the OPWDD field for 8 years.
Okay, thank you, Kristen. And now we've said Jawonio like at least 3 or 4 times now. So Randy, do you want to tell us about Jawonio and a little bit of what it is, what it does?
Sure. So Jawonio is a human service provider in Rockland County, primarily. We've been here since 1947. We originally started as the Cerebral Palsy Society of Rockland County. It was started by a group of parents that wanted more for their loved ones. It started as an outpatient program for children with neuromuscular and other disabilities, and in 1949 became a camp and continued to grow over the next 74 years. So we now provide a lifespan of services for more than 3,000 children and adults. We are located in both Westchester and Rockland County. Our main site is in New City. We have a 16-acre campus here. Every year we serve thousands of children and adults. Jawonio, for those of you that don't know, is a Native American word that means independence. And that's really at the core of everything that we do here. We focus on, helping people to reach their level of independence. We have about 900 employees. So we're about the 7th largest employer in Rockland County. And we have, as I said, a lifespan of services. So we have early intervention services, preschool. We do a summer education program. We have respite. We also have residential programs in just Rockland County. We do pre-vocational services. We have an Article 16 clinic that does physical therapy, occupational therapy, speech, and some counseling services. We have a personal recovery-oriented service program that really focuses on mental health services focused on a person-centered and strength-based approach. So they have counseling classes, job assistance, support, and psychiatric services. We have a health home care management program, and that really supports services are focused on wellness and helping adults that are Medicaid eligible that have mental health and behavioral diagnosis or chronic medical conditions. We also do a large supportive employment program. We have drop-in centers in our Westchester's locations. We have a consumer-driven personal assistance program where we provide services in people's homes. And we also have a very large cleaning company that cleans a number of both county and state buildings in Westchester and Rockland County, as well as some private businesses. So as you can see, we offer a wide range of services and touch a number of different diagnoses. Autism is included amongst those.
Yeah, wow, it's a lot. I mean, I knew about Giovanni, but I didn't know that it was so big. And you have 900 employees?
Yes.
Jeez, I have no idea. Well, the same way that I'm asking questions here already, please, I invite all of our attendees to use the chat box or the Q&A box and start asking your questions, because this doesn't happen every day that we can ask the questions that we want to experts in the autism field. So let's start talking a little bit about autism. So what is autism?
So autism is a developmental diagnosis that affects several major areas of an individual's life. It affects their communication abilities and their skills. We see individuals with autism struggle in communicating with others, whether they are verbal but have limited expression, or nonverbal and have to find alternative ways to communicate with others. There's also these socialization deficits we see in autism. Individuals with autism have a difficult time with social cues and interactions with others, where they struggle a little bit more to do things like making eye contact, communicating things that they want to discuss, or to have that reciprocal conversation with others. They also have very highly restricted interests, whether it's toys or trains or cars. They have these very specific interests that they enjoy thoroughly, and sometimes have a difficult time having conversations with others about anything else besides their key interests. So having that relationship back and forth and the conversation can be very difficult with individuals with autism. They also struggle with sensory processing issues. Some individuals with autism either have a very sensitive, highly in-tuned sensory processing, whether it's their visual, tactile, hearing, textual, taste, smell. All of their sensory processing is either on a heightened sense, where they experience things so severely where simple fluorescent lighting may be very detrimental to their eyes and make it difficult to concentrate on things. So how they interact with their environments around them is very different from how you or I may interact, because we don't pick up on some of the things that may affect them a lot more. On the flip side of the coin, individuals with autism also may have a lack of sensory input, and they need to make up for that by engaging in behaviors known as STIM behaviors, which you'll typically see as rocking back and forth or clapping, to kind of bring that sensory processing back to self-soothe and to self-regulate themselves. We do see a lot of those repetitive behaviors as well. You'll see individuals engaging in things that are self-soothing to them. So highly restricted interests, highly specific routines, and not wanting to deter from those routines. So transitions are really difficult for individuals with autism to move from an activity that they seem very enjoyable to something that they may not want to do, but need to do to live a healthy and fulfilling life. So there's a lot of difficulties with routines and structures. We may see some socially inappropriate behavior, again, because of that socialization difficulty and not understanding social cues. They may not understand how to have a reciprocal relationship or what's appropriate given the setting that they're in. So it's not that these individuals don't understand, it's that the connections that are made or that we make on an easier basis is more difficult for them. And I want to stress that although they have these socialization and communication issues, it's not that they don't want to have these relationships or maintain these relationships. They have difficulty doing so and need the assistance of others to kind of learn some of these cultural accepting norms that we know that don't come so easy to them.
And with everything that you're saying, I'm thinking, well, yes, there are a lot of I will say, signs that someone can have autism, but at the same time, it might look normal as well. You know, if you're shy or something like that, I guess. So what is the age, I guess, where you can diagnose autism, and also like, how do you make that difference if it's not like just a personality issue versus, you know, something more serious like autism?
Absolutely. And that's a really good point to make, is that autism doesn't have a look. I've heard a quote time and time again that once you meet one person with autism, you've met one person with autism. You have not met everybody, and everybody looks very different. Autism does not have physical characteristics, so you couldn't tell that someone's autistic just by looking at them, but by seeing more of their behaviors and getting an understanding of how they act in their surroundings can give you some clues. But the American Pediatrics Association actually suggests screening as early as 18 months of age. The typical age of individuals diagnosed with autism is around 3 or 4 years old. So they can be diagnosed at a severely young age where they can get the interventions and the systems they need in place to help them to be more successful. So it's really important that parents are looking at those milestones and seeing if their child is hitting them. Another major feature of autism is eye contact, or having poor eye contact. So if you notice that your little one is not engaging in eye contact or reciprocal play with their peers or with their parents, that's something to look out for, and that's a red flag. So parents who are seeing these milestones that may have a delay, or they're not reaching them when they should be, as their cohort is, going to their pediatrician to ask for a screening for autism. And again, like I said, as early as 18 months. But the average age that we see, I mentioned, was 3 years old, but it can also go as late as 6 years old. And when we see with individuals with autism who are diagnosed at a later age, that they have more difficulty learning the skills because they're not getting the early start that they would have at an earlier diagnosis.
Mm-hmm. Are there different levels of autism?
There is actually 3 different levels that have been determined with autism: level 1, 2, and 3. Level 1 autism is individuals who require support, but this is the level of autism, what we used to know as Asperger's, where it's individuals who are higher functioning and have maybe more difficulty with organization skills, some communication skills, but they are verbal, they are driving cars and holding jobs. They are able to have a higher level of independence with mild or minimal support from their family or from service providers. Level 2 is requiring substantial support. They have limited social interaction, difficulty having that reciprocal conversation, very narrowed interests, and requiring more staff to kind of help them through their day-to-day, and difficulty with transitioning. When we see going towards more of the level 3, the substantial or very substantial support, these are individuals who are more nonverbal, engaging in more self-injurious behaviors, difficulty being able to regulate themselves or utilize coping skills to help them be successful in their daily functioning. So we see it on 1, 2, 3. And as we know, autism is a spectrum, and it comes in many different shapes and colors. And where one person may have a higher ability in their communication skills, they may have more deficits in their behavioral or socialization. So they really fluctuate between those categories, and being able to know where their strengths are and where their deficits are is going to be the best way to help them be more successful in using a strength-based approach.
Mm-hmm. Now, obviously, we all know that autism can be very challenging, not just for the individual, especially children with autism, but also for their families. So what are some of these challenges that they face, you know, as individuals, but also as family, or, you know, as a mother, as a father of children with autism?
Well, when it comes to the caregivers, the family members and the friends, it can be very difficult just engaging in caregiver burnout. You know, individuals with autism may require a lot of attention. So making sure that the individuals are also taking care of themselves and their siblings. We do see a lot of individuals with autism who have siblings. There's a lot of increased sibling rivalry when it comes to attention seeking and, you know, feeling a little bit left out. As we know, individuals with autism need support, so there might be some more struggling or conflict from the siblings as well. And it's important that they receive the services to help them understand that it's not a battle between the siblings, but just that the support may look different from one to the other. For siblings, for parents, it's important to reach out to the community and have their own supports so that they can be the most effective parents and family members as possible. When we look at individuals with autism, we like to look at the whole picture, because it's important working with parents to give them the skills and the tools of how to have their individual be more successful in the home, but also that they're taking care of themselves too, and that their needs are being addressed as well. So it's really important that we don't just isolate and focus on the individual at autism, but we look at the system as a whole and make sure that it's functioning properly. But when it comes to individuals with autism, there's many challenges that they may encounter. Our individuals with developmental disabilities have a hard time securing employment. That's just one across the board. So making sure that they have the skill building, whether it's supportive employment services, job coaching, or pre-vocational training, to really understand what it is to be in a job and the responsibilities, and learning the skills to be able to hold, maintain successful employment. So that's just one off the bat. There's a lot of behavioral challenges that comes with individuals with autism, and being able to have that self-regulation and self-coping skills, but learning how to do it in a more effective way. So I've worked with many individuals who actually have jobs and are very successful, but will engage in these repetitive or STEM behaviors behind closed doors, because it's this compulsion that they need to engage at to kind of re-regulate themselves. So being able to understand social appropriate behavior in the community, and also how to develop those coping skills to help them be more successful, is really important. Individuals with autism and any other developmental disability, but autism specifically, are no stranger to mental illness. Just because someone has a developmental disability like autism does not mean that they are unable to get a mental disorder or to develop a mental disorder. So we see a lot of individuals with anxiety disorders, mood disorders like bipolar, ADHD, depressive disorders, pica, which is eating or ingesting non-edible items, and self-injurious behavior. So not only are they challenged with or struggling with their diagnosis of autism and how to cope and regulate themselves that way, but they have this additional set of situations and symptoms that come with other mental health illnesses as well. It's unfortunate, but a lot of providers don't necessarily diagnose individuals with developmental disabilities with mental illness, because it looks so different from a normal population. So someone with depression and autism will not look the same as someone who has normal cognitive functioning and depression as well. So the presentation is very different, and sometimes it's missed, which is unfortunate. Same with psychotic disorders as well. So it's important that these individuals are receiving the appropriate services, and that we're making sure that we're addressing all challenges and all issues, and not just focusing on one where it might be something else that's really driving, the system in place.
Mm-hmm. So Kristen, if I'm understanding correctly, we need to I will say treat autism more with like skill builders and teaching and so forth. Is there also like medication or medical treatments, something like that? Or is most important to be able to provide, good services, good therapy to people with autism?
Well, just like it's with any other mental illness, it's important to look at the entire picture and come from a biopsychosocial approach, and making sure that you're addressing all things. If we're just treating with medication, it's not really giving them the skills or the ability to learn how to regulate without that medication or without that treatment. So we want to make sure we're addressing it in a behavioral approach, a cognitive approach, as well as a medication approach. So having that skill building and having services like intensive behavioral services or behavior specialists or job coaches and things like that are helping the individuals learn how to regulate themselves without the assistance of medication. But we do see individuals being successful with both. So it's better to have the whole picture in place than just picking and choosing one thing specifically.
Mm-hmm. And I think, thank you. And I think that your answer actually leads to my next question, because you just said success, right? So how do we measure success in a person with autism? Because I imagine that life is not that easy. You just said, it's high rates of unemployment, low education, things like that. But then how do we measure success? When is a person, I guess, fulfilled? I don't know.
Well, success comes in many different forms. And I think when, we or even parents are thinking of how can my child be successful, it may not be something that is within the realm of that individual or their capability. So success for that person may be learning chained behaviors of how to brush their teeth in the morning, or how to dress in the morning appropriately with the weather. Being able to communicate 1 or 2 words or utilizing their communication devices if they are nonverbal. So success, it's many baby steps leading up to a major success. So, when it comes to any treatment with autism, it's not going to wipe away all of the symptoms or cure. That's not what we do when it comes to behavioral. We want to alleviate, decrease, lessen some of the challenges that they are experiencing. So when we look at some of these things that might be seen as a small milestone for you and I, may be huge milestones and huge achievements for individuals with autism. Being able to speak on this platform alone, is something that we would want to encourage individuals with autism to just have that communication and say hi, maintaining eye contact. So success is however the individual decides and what their goals are, and how can we get them as quickly and safely as possible. But being realistic and really praising those achievements that they make on a day-to-day basis.
Yeah, sounds like success is progress, whatever progress looks like. Good. Okay, we might have young mothers out there, maybe first-time mothers. And of course, we don't have other children to compare to. So when do mothers or even fathers, whomever it is, when do they need to be alert and seek help? How do you know that something is going on?
I would say for all young parents, looking for those early milestones. And there's even a wonderful website called Navigating Autism that is a great resource for young parents to really see all the milestones that their child should be hitting and some of the red flags to be looking out for. So, when we think of our little ones, when they're even a few months old, they're making eye contact. They want to have that physical touch. They are babbling and mimicking what we're doing. If you're not seeing things like that, and it's the difference between being shy and just not engaged. And we want to make sure that we aren't addressing a personality trait versus a symptom. But if we're not making eye contact and they don't want to be held, or they're not able to self-soothe and playing off by themselves and not engaging in two-person play or reciprocal play with another person, those are some of the red flags that you want to look out for. So although we can screen as early as 18 months, young parents really should be looking by 1 month and moving forward to make sure that they're not missing anything.
Okay, so I guess it's important to talk to the pediatrician and see if your child is meeting those milestones within the right range, I guess.
Absolutely.
Okay. So for these families, where can they find, you just said Navigating Autism, and are there any local resources, anything that they can reach out to?
Autism Speaks is another great resource. We have a lot of, New York is very fortunate to have as many autism programs that we do have. But if there was any resources that they wanted to do locally, Juanio, we have our early intervention program. We have behavior specialists here on board. We do assessments. Having care managers is really important too. So reaching out to your local officials to see what services are available is really important.
Thank you, Kristen. Randy, there is something called Autism Resource and Training Center, correct?
Yes.
Do you want to tell us a little bit about that?
Sure. So Juanio was seeing a steady increase in the number of referrals we were getting for people on the autism spectrum, and we had put in a legislative grant to develop a resource and training center for not only individuals, families, but for community organizations, professionals, and first responders. So the Resource and Training Center really provides a variety of trainings centered around the autism spectrum disorders, and helps the learners in a variety of areas ranging from, understanding the diagnosis, much of like what Kristen was talking about, to partnering with your school districts, advocacy and entitlements, addressing behavioral challenges, as well as a number of other areas. So we had a group of our professionals here at Juwanio, as well as some community members, come together to develop a variety of sessions that are available to families and individuals, both in person and via Zoom. And we are also, for each of the sessions, we put together PowerPoint presentations. The sessions have been recorded and they're going to be available on our, or through our website on our YouTube page.
Thank you. What about support groups? Will support groups be important for these families?
Well, that's where I come in. So yes, they're very important. And that's what I run. I have them once a month, and they're basically there for, it's a safe place for people to share. I think that there's a lot of stress as a caregiver, as a family member, anyone who's affected by this. It can be very frustrating. And I am running support groups for people that are struggling with that. And that could be a caregiver, a family member, basically anybody who's affected. I do want to add, along with everything that's being said, we are really very fortunate here in Juwanio because we have incredibly kind, patient staff that really take the time, because this is a very difficult population to work with. I think it's difficult to have a family member or a loved one who suffers with this, but we really have staff that are educated and are very supportive. And I think that makes a very big difference. So along with that, I've been running my groups and it's been pretty successful, but I want everybody to know that that's out there, because I think this is a place where people can come and they can heal and they can feel better struggling with this.
And Carla, what type of struggles do you see in these families?
I think basically what you were saying before, it's very frustrating. I think parents have expectations of their child, which are at times very unrealistic. The child may have expectations of themselves, siblings especially. It's very, very frustrating. It creates a lot of anger. Statistically speaking, many marriages fall apart due to it. It's extremely stressful. And what's nice is if we have parents or caregivers that are together, they can learn from each other. It's you know that you're not alone. There's many things, there's many ways that we support one another. And I run the groups with that intention, with people being able to heal and being able to get through this. And what's nice is that some families have certain ideas, other people have different ideas. Whoever comes, they all can share how they've gotten through. And by me sort of guiding that, it usually works very well. It's a very healing group that I run.
Mm-hmm. Is there any interaction or community building because of these support groups?
Well, I realize that with autism, it's not that prevalent in this area to have support groups specifically for autism. And I think that's where we're trying to make that more available to families and to people. That's part of why we're doing this. I've heard of many people struggling with it, but there aren't very specific groups for it. So it's very exciting what we're doing, in my opinion, because it is a big start. NAMI is a big group that's basically geared more toward mental illness. And so it's very exciting that we're having things a little bit more geared toward autism and the developmentally disabled, because it's sort of a population that tends to get forgotten.
Mm-hmm. Yes, thank you, Carla. Randy, what other services are available for families with autism? And I'm just going to say families with autism because I feel that it's, it affects the whole family, correct? Okay.
Yeah, so I mean, as I mentioned earlier, we have a large range of services, and I will say that, especially with autism, early intervention is key. So as Kristen had mentioned, if your child's not meeting those milestones, to reach out because we do have an early intervention program here that starts at about 1.5 years old and goes all the way up to the age of 3, and at which point they can go over into our preschool and get, some help and support. Many of these children, they need occupational therapy, speech therapy. We do have a variety of behavioral supports that we use. We do offer intensive behavioral support services where we work with families to develop behavior support plans for their child and train them on them. Consistency is very important in working with people on the spectrum. We do also have supportive employment for, if the child is older and ready for that, where we can help to support them in different types of employment. We have day services available for individuals that are, on the spectrum. We have residential care, throughout Rockland County. So we place people residentially that need a higher level of support. So we really, I think, we cover a very wide range of services. And, my best advice to families is visit our website, www.juanio.org, because on that website, it will show you all the services that we do offer and give you information on how to contact us so we can help you.
And do you also give workshops?
Yeah, well, that's what we're doing with the Autism Resource and Training Center. So we have a number of workshops that are already pre-planned. They're also on our website. The next one we have coming up is on November 17th. It's Understanding the Diagnosis. But we have, other workshops that are going to be coming online. On December 1st, we'll be offering Impact on Health and Wellness for individuals with autism. On December 7th and 9th, we have somebody that's coming to talk about the American with Disabilities Act. And then on December 15th, we have behavior planning. And then starting in January, we'll have a whole bunch of other sessions that will become available. And again, those are available to come in person or via Zoom. And we will be recording them, and they will be available after on our YouTube channel that you can access through our website. The family support groups are only in person, and those are generally on Wednesdays at 5 once a month, and those are posted on our website as well.
Mm-hmm. And, I always like to hear success stories, especially, when we talk about autism and, some challenging diagnosis like this one. Can each one of you share a success story that you had? Kristen, you want to start?
I have one right off the bat, and it goes just again towards the communication and being able to find how individuals with autism can communicate. I worked with a young boy who was about 5 years old with autism, and his family was working on getting him an IQ test just to see where his level of ability was. And because he was nonverbal, he was not able to communicate and did not get a passing score on the IQ test. They could not get a actual score to replicate or identify what his IQ actually was. It wasn't for a few months that we found out that he is unable to speak, but he can type. And from him being able to type, we were able to do his IQ test and learned so much about this young boy that was just locked inside of his head and unable to share because of this communication barrier. Through his IQ test, we found out that he had an IQ of 145. He understood English, Spanish, French, and Arabic. He knew everything about the solar system and just continued to grow and flourish as soon as we found out and broke through that wall of how we can get through to him and how we can have him communicate to us. So that to me is one of my favorite success stories of being able to see that, it's there. It's just being able to think about it in a different way and how can we work with these people to encourage their strengths. And his was through written communication.
But wait, Kristen, back up a little because you lost me somewhere. The QI, what's the lowest and what's the highest?
The average IQ of an individual is 100. So to say he has an IQ of 145, he's in that Albert Einstein area and was able to tell us the the distance between the earth and the sun by the decimal. He was very, very bright, very smart, and 5 years old.
And you said that he spoke like 4 languages. How did he learn 4 languages?
By hearing. He watched TV, he watched Dora the Explorer, he watched TV, his family spoke another language, and they were able to figure out that he knew exactly what they were saying. So it just opened up so many doors and possibilities for him by being able to learn the wide range of his abilities, and not his deficits, but really what he was capable of.
Yeah, oh my God, thank you for sharing that. That's such an inspiring story. Carla, do you have another story? Like, this is hard to beat, I guess.
I was gonna say, this is very hard to beat, and I don't have anything to beat that. But what I do have is that I've been very honored in a lot of the groups that I've run here of being able to see the realness of people that care about their family members, about their loved ones, and to really be honored to sit with a group who are trying to get through what is such a difficult, it's the cards that life have handed you, and not always getting exactly what you wanted, and to be able to sit with people in their tears, in their frustration, in their anger, to sit with one another, and the feeling in a group when they realize that they're not alone, and that they feel better when they leave my room, that they have supports. And it's really just been an honor for me to be able to sit with people with this much sadness and frustration, and to watch people have hope. And I think hope is what a lot of people are missing nowadays, especially now in this difficult time. So to be able to instill hope in individuals, for me, has been very moving. So for me, that's my, and I don't know that I want to call it success. For me, it's just more of an honor.
That's beautiful, Carla. Thank you so much for sharing, but also for doing what you do. I think that's amazing. Randy.
So I've seen many success stories over the years. I don't know if I could pinpoint just one, but because of the approach that we take, it's a multidisciplinary approach. So we're looking at the whole person from a number of angles. We've had individuals that have come in with very, very challenging behaviors and have been able to, work with them, develop plans to help support them, and watch people that could barely function through the day because they had these significant behaviors to be able to be out in the community, to get a job in some cases. And I think that there's a lot of success stories, and those success stories come from Juanio's really hardworking staff that are really dedicated to getting people to be as independent as possible and to engage every part of our treatment team to help them along that way.
Well, thank you so much. And thank you for being my panel today. I think, I always like to end on a positive note. Definitely, I think we ended up on a positive note today. And thank you for everything that you do, because obviously working with children and families and individuals with disabilities is not an easy task. So thank you for your love and your dedication. And next week, we're going to be talking about home care, tips for caregivers and those thinking about it. So we also know how hard it is to care for a loved one at home and the challenges that also brings. So that's what we're going to be talking about next week. And that's all for today. Thank you so much for being here, and thank you to all our attendees. See you next week.
Thank you for having us.
Thank you.
All right, bye-bye.